So I've had knee pain before for a variety of reasons. I probably squatted incorrectly, or squatted incorrectly. Now this video isn't about squats. We're going to be talking about running because squatting isn't a condition of your employment. Running is. Now when I had this pain, I couldn't even sit in a long car ride without my knees screaming out to straighten out my legs. Now if you have patellafemoral pain syndrome, you may have pain around the kneecap when you're walking up the stairs, when you're sitting for a long time, squatting, or when you're running. Now, before I get to what can cause or contribute to that, let me quickly describe what chondromalacia patella is. It's when the cartilage under your kneecap degenerates or softens. And with chondromalacia patella, you may hear a grating sound or a grinding sensation when you're bending or straightening your knee. And in a bit, we're going to talk about the causes of each, how to address these conditions, and some of the things that you can do to help prevent them from happening in the first place so you can smash your runs without smashing your knees. So what contributes to these things? The biggest culprits are muscle imbalances and weaknesses around your knee. Your quads are the main stabilizers of your patella, also known as the kneecap, and in order to keep it in place, all of the quads around your knee need to have sufficient strength. On the outside of the knee, you have vastus lateralis. In the middle, you have rectus femoris and vastus intermedius. And towards the inside of your body, you have vastus medialis oblique, which is also known as the VMO. The vastus lateralis stabilizes your knee by pulling it laterally. The medialis stabilizes it by pulling it medially towards the inside of your body. And rectus femoris and intermedius stabilizes it centrally. Most people's problems is that vastus lateralis is way stronger than vastus medialis. So the patella is pulled way too far laterally, so now your knee doesn't track properly in line with your feet. So when doing anything that normally places some stress on the knee, like running, excess stress on the knee is going to be applied to your cartilage, which is under the kneecap. Two other causes that can be contributing to this are tight hamstrings and weak quads, both of which increase the pressure between your femur and your kneecap. Issues regarding the hamstrings and the quads are some of the biggest culprits, but some other factors can be too large an increase in the frequency of your running, the intensity of your running, a wide Q angle, which is a bigger concern for female applicants, knock knees, bow leg, improper footwear, and overpronation of the feet. So what can you do to address these types of knee pain? Do exercises that strengthen the quads. All right, so this is the free weight body weight squat. In order to get all the muscles engaged that we need, feet are going to be about hip width apart, toes are and from here we're trying to come down properly. Our knees will not be colliding in like this. This is knee valgus. Out like so, up. And hip muscles, including the ones like rectus femoris and the hip muscles like your abductors. Stretch your hamstrings. Wear proper footwear and orthotics or inserts, maybe a knee brace to help stabilize the knee. And if you have unequal leg length, you may want to consider a heel lift. Now, last but not least, refrain from increasing your weekly running mileage more than 10% per week. I could have said a lot more in this video, but I'm trying to keep these videos under 3 minutes now. So please ask me any questions in the comments or the DMs if you have them, and I'll be happy to help you. And until next time, gotta go.